Over the last week, the number of doses being administered daily in Canada has dropped by half, and it's a problem for two reasons. Not only does it mean fewer people are being protected against COVID-19, but it means some doses could go to waste.
No healthcare provider wants to be in the precarious position of having to dispose of what is liquid gold in the vaccines.
And when the vaccines arrive in Canada, they're stored in freezers. The provinces place orders for how many doses they believe they'll need a month ahead of time, and those doses are shipped to doctors' offices, pharmacies, and vaccination centers. But then the clock starts ticking.
Once they're thawed, you really have about 28 days to use those vaccines. And you can't refreeze them or repackage them and put them back in the box and send them elsewhere. They've got to be used.
Dr. Bogosh is part of Ontario's vaccine task force, and he points out there has been far less wastage in the COVID-19 vaccination campaign compared to the seasonal flu. Those soon-to-be expiring doses can be moved across the province to other regions, but it's just too complicated to donate them to developing countries.
If you look at the time to extract, to do the quality assurance, to inspect every single vial to make sure they're not spoiled, and then to ship it, it's going to take longer than a couple of weeks.
While some doses have already gone to waste, the government is making sure the developing world gets vaccines. According to Gavi, the Vaccine Alliance, Canada is fourth in the world when it comes to donating doses of COVID-19 vaccine to the rest of the world, just ahead of Japan. That's in addition to the hundreds of millions of dollars pledged to purchase vaccines for poorer countries. A spokesperson from the Department of International Development acknowledged there is some vaccine wastage in Canada, but added it's less than 1% of the nearly 60 million doses that have been delivered to the provinces. Farah?
Mike Le Couteur in Ottawa. Thank you, Mike.